In cancer patients, because of many factors, and especially related to the cancer per se, but related to all the necessary treatment, there is a risk of pulmonary embolism which is enhanced by 1 to 3-fold compared to the rest of the population. And basically, 20% of the patients with cancer may be at risk of developing venous thromboembolism, and 1 out of 7 patients with cancer may die from pulmonary embolism. This is the reason for which, over the past 20 years, the whole medical community has been progressively has raised interest about this critical point. We, over the world, many teams are working on this subject, trying not only to improve treatment, but to improve understanding the physiopathology and to take better care of patients. And this is very interesting because today patients with cancer live longer because we can cure the cancer, and therefore they develop other complications, and among these complications is venous thromboembolism. And now, today, it is of importance to understand that venous thromboembolism has become the second cause of death in cancer patients. It is not anymore infectious complications, it is pulmonary embolism or venous thrombosis. Not only the pulmonary embolism per se, but also the complications that may be associated with the treatment, because when you have a venous thrombosis, whether it is related to peripheral and the risk of pulmonary embolism, whether it is directly pulmonary embolism, approximately 1/3 of the case to 40% of the case, or whether it is related to the indwelling catheter that many patients have to be able to have a direct access to the venous, the veins to treat patients and to be able to infuse the chemotherapy and to do the supportive care, this risk is enhanced, and therefore we have to treat adequately.